All right, good morning, guys. So welcome to the shoulder pain workshop. I'm going to take off my mask here so you guys can see me a little bit better. So we're going to be looking at the comments as we go along. But then also, if you guys didn't receive the handout for the shoulder pain workshop, let us know. My concept of it was going to have you guys follow along with it. But if we can't, then just do your best you can going through the PowerPoint. We're going to pull that up here. Do you know how to pull the PowerPoint? Yeah. Sorry, I am not the best at Zoom, so you'll have to forgive me. So we're gonna pull that up right now. You guys will be seeing the PowerPoint momentarily. Okay, awesome. If you guys can't see the PowerPoint, just shoot a comment in the comment section. So this is the shoulder pain workshop. I'm Bridgette. I'm a physical therapist here at Body Central Physical Therapy. And I'm trying to go to the next slide here. Perfect. Okay, so a little bit about me. I've been working here for Body Central for 2 years, and I'm originally from Wisconsin, and I went to Carroll University in Waukesha, Wisconsin. It's a small little Division III school where I played basketball there, and that's where I got my exercise science degree with my minor in psychology. And then went on from there. I went to the College of St. Scholastica up in Duluth, Minnesota. So if we got any Midwest people here, all right. And I didn't quite receive my master's degree, so I'll need a little internship to kind of complete that. So I can't quite say I have that, but I have my education in exercise physiology, taking us to where I attended PT school at the University of St. Augustine for health sciences out in San Diego, California. And there is when obviously we had a lot of our learning clinical rotations, and that's when I first started getting interested in shoulder injuries and shoulder pain. I'll be honest, I never really have witnessed any of it myself, but I did one of my clinical rotations underneath one of the best physical therapists I have ever met. And he used to be the old San Diego Padres personal trainer and physical therapist. And so he taught me so much about shoulder pain and all sorts of things that I'm going to present to you guys today. In addition to a lot of things I see in the clinic, I kind of talk about myself as being the shoulder gal. So we're just going to get started, okay? And whatever questions you guys have throughout the presentation, you just let me know. Alexa will go ahead and get my attention to if there's something I'm not seeing. So yeah, feel free to ask questions throughout this entire process, okay? I'm sorry? Oh, yep, in the chat. That's where you guys can go ahead and put your questions if you have any, okay? Paula's here helping me through this PowerPoint here. All right, so about the shoulder. Our little all-star lineup here is we're going to be talking about just the anatomy of the shoulder, what it is made up of the shoulder. We're going to talk about the shoulder function. We're going to be talking about different causes of shoulder pain, which then will lead to different pathologies of, what causes shoulder issues that you guys might be experiencing. Then I'm going to be going through some helpful exercises to take you guys through. We're going to show some pictures and then maybe a couple demonstrations of some of them towards the end. And then we'll talk about some further steps. If you guys continue to have shoulder pain or after some different things you've tried, then we'll talk about what are some things you can do in the future to kind of make sure we can get that handled for you. Okay, so what makes up the shoulder joint? I'm just going to keep this plain and simple. We have the arm bone, upper arm bone. I don't know if you guys can see my mouse, but this is this guy right here. That's our humerus. A lot of jokes are made about it. It's very humorous. And then it is connected to our shoulder blade, and that's this guy right here. It's got a lot of different bony prominences to it, which then attach kind of our clavicle, which is known as our collarbone. So as far as the bones, those are the biggies that are kind of making up the shoulder joint. We're going to go into more detail, but just kind of getting you acquainted with just some simple facts here. So then looking at the capsule, this looks like a way more detailed picture than what you just saw on this page before, with just the bones meeting up. The capsule is what keeps, honestly, the head of the humerus on our scapula. And so you can see it is completely enclosed all the way around. Basically, the shoulder joint is known as our ball and socket joint. So for you guys who have the handout, you guys can fill in your little fill in the blanks that, our shoulder is a ball and socket joint. And it's very similar, concept to our hip joint, but we're going to talk about the differences between the two in just a little bit. But as far as the capsule goes, it provides stability for our actual shoulder joint. It helps keep everything in and make sure that we are not having any form of, dislocations, any sort of things that aren't supposed to happen. So little fun fact I put at the bottom is the ligaments attach bone to bone. We always hear like, oh, do I have a tendon problem? Do I have a ligament problem? So usually the best way to describe this is tendons attach muscle to bone and ligaments attach bone to bone. And so there's all sorts of little ligaments throughout our capsule here that make up our shoulder joint, or our glenohumeral joint is what the technical term is for our shoulder. It makes up that entire capsule. And then you can see kind of above here, we have different ligaments that help our collarbone attached to our shoulder blade and all sorts of good stuff that keep our shoulders stable. All right, so muscles. This is my favorite thing about the shoulder. So we're going to go into really great detail about the muscles. But what I want you guys just to take a look at here, on our left-hand side, we have kind of our superficial muscles. We have our deltoid, we have our pec. We have, you know, kind of drawn out here is our biceps, triceps in the back. Those are all the muscles that you see everyone working out at the gym and trying to get nice and strong, especially for the beach, you know. Gun show. Had to. My dad always likes, did you buy tickets to the gun show? So those are your big movement muscles there. But the muscles that I'm going to draw more attention to are our deep muscles. And those are our stabilizers. And those guys are what is going to be the bread and butter of keeping our shoulder joint nice and healthy and keeping everything nice and stable so you guys don't have shoulder pain long term. So moving forward, we're going to be talking about how the shoulder pain works, or I'm sorry, how the shoulder joint works. I'm sorry about that. Does anyone have any questions so far before we continue? I see that there's some comments in the chat. Yeah, so Pat, I see you have a question here about the neck, and Joy, we're going to get into that. We're going to be getting into common pathologies, different things that are going on in the shoulder, but we'll get there towards the end, okay? And if if you need me to readdress that question later, just go ahead and repost that comment, okay? But we're going to get into how the shoulder joint works real quick here, okay? I can. Sorry, one moment. Paula wants to admit some more people from the waiting room here, so we're going to stop the presentation momentarily. Apologies about that. While she's going ahead and taking care of that, if for those of you who have our handout present, there's a bonus question. And so the question is, how many muscles attach to our shoulder blade? So if you guys want to drop your answers in the comment section, or if you don't have access to that, that's okay. I have like a multiple choice answers. I have 17 muscles, 9 muscles, no muscles at all. And so if you guys want to take a guess as to, as far as how many attach to our actual shoulder blade. Now we got a comma. Do we have an answer? 17. And Martha, okay. John says 10. All right. We got some good guesses here. Someone says none. Felicia, okay. So to give you guys the correct answer here, we have 17 muscles that attach to our shoulder blade. And if I sat here and tried to name them all, this would be the whole presentation. So yeah, we have a lot of muscles at work in order to have our shoulder blade move. So there are 17 different little muscles and bigger muscles that attach to that shoulder blade to make the shoulder blade do what it does, which we'll talk about later on. Okay, so moving on to our next slide here. Okay, so joint mechanics. This is probably the most complicated slide on this whole presentation. Basically, what you need to know that our shoulder joint, I like to describe it as a golf ball on a golf tee. So for all of you golfers out there, you know that a golf tee is pretty shallow, right? It's more like a crescent moon, because when that golf ball sits on it, you need to be able to hit it. And if it was more like a C joint, kind of like this, it really wouldn't go anywhere. That's kind of more how our hip is set up. It's very much enclosed in a ball and socket joint like this. Our shoulder joint is more like this. So it is much more of a movable joint and actually, has good things for it and bad things for it, pros and cons to that type of joint. But basically what we're looking at here is the concept of the roll and the slide. And this is one of the concepts that is actually on your guys' handout, that when our arm is rising, what's happening is we're rolling in one direction and we're sliding in another. And the purpose of that, just taking away from that, is when we have a roll, we're going up like this. And the slide helps keep it within the shoulder joint. So we're staying nice and congruent. We're not going outside that golf tee, and everything is moving the way that it should. If we didn't have that roll inside concept, let's just say we had the roll, right? We would just roll right off the top, roll right off the side, into all sorts of different directions off of that golf tee, and that would be painful, A, and inefficient. So our shoulder joint is built to roll and it's built to slide. Kind of one of the concepts that is a little bit actually kind of challenging to learn, and actually in physical therapy school takes you a little while to get that full concept down in a more advanced way. But as simple as that, that is what is going on with how that actual joint is moving. Okay, we have a question from Liz. Okay, does pain between the shoulder blades involve the shoulder blades, or can it be from neck or ribs out of place? Yeah, so we are so going to get to the neck and ribs and spine, guys. I will answer and address all those questions. When I get to those kind of areas, it'll definitely kind of help answer those questions, okay? And so I will address all those when it gets to a little bit more of why you guys are having shoulder pain, certain reasons as to why that's occurring. You will definitely see that later in the presentation, and I will go over your questions individually. If you have questions on what we're going through in this moment, go ahead and drop those comments right now. And then towards the end, if the presentation has not answered your shoulder pain question, then we'll dive into those, okay? So, and we have some people more in the waiting room. Alexa, are you able to mute those people so we can keep rolling with the presentation?
No, only you guys have access.
Okay, well, and that's fine. Apologies, guys. You know, we have that waiting room set up to let people in, so I apologize for a little bit of the delay. So we'll talk about the handout a little bit while Paula's admitting some more people. But basically, the role of, we're going to get into shoulder blade function, or I'm sorry, kind of stability, musculature function next. And so we are going to be talking a great deal about the rotator cuff. I'm sure a lot of people have heard about the rotator cuff. It's okay, sorry, you guys. Hang tight, everyone. Apologize. There's the people. It's at the top. Yeah. All right. Awesome. So we're going to get into the muscle components. Like I said, my favorite component. So I'm a little biased because a reason why a lot of people have shoulder joint pain is literally because of our stability musculature, with it not doing its job. So I want to point out the 4 most important muscles for stability, because there's a lot of muscles that contribute to our shoulder stability. So this list could be a little bit longer than that, but the big guys here, we have our rotator cuff muscles. So that consists of our supraspinatus muscle. And if you guys can see my mouse, that's great. If not, let me know. That is this guy right in through here. So our rotator cuff muscles they come from our shoulder blade and attach to our arm bone. So they are muscles that are super, super deep. They're our deepest muscles we have that attach right on those bones. And so then we have the infraspinatus. That's this guy hanging out right here. And we have our teres minor, which is just below it. And then this is kind of the backside of our shoulder blade. We got these guys right in through here. And then we have one that's sitting on the front side of our shoulder blade called the subscapulars. Don't worry about the names too much, guys. Basically, know you've got 3 in the back, 1 in the front. And their literal purpose in life is to keep that golf ball on the golf tee. In addition to our capsule, you can see that when we have that shoulder joint that is just that nice little crescent moon, a golf tee, it needs reinforcements to kind of keep it there. That's why you hear a lot about people dislocating their shoulders versus their hips, right? When you hear about things happening like football injuries and baseball injuries. And so the rotator cuff there is like a second defense to make sure this stays here and it stays moving nice and smooth. So when we have a rotator cuff issue, a tear, weakness, it can cause all sorts of things, okay? And so that's what we're going to dive into, but I just want to like star this slide. Make sure you write it in your boxes when it says relevant stability muscles. Really get these 4 down, okay? And then we got a whole separate slide for our 5th stability muscle that is listed on your guys' handout here. And that is the serratus anterior. So this is a muscle that it's kind of a weird one, honestly. It connects to our ribs. You guys can see it here. It connects to every single rib. And then it connects to the back side of the shoulder blade. So this is going to kind of maybe lead into one of the questions that was in our chat a little bit earlier, where the shoulder blade and the rib cage. Oh, let me make sure everyone's, oops, sorry. Moving ahead. So basically its purpose is to suction that shoulder blade onto our rib cage and across our thoracic spine. And honestly, when you don't have that sort of happening, you create winging. I'm sure people have done like the little party trick or seen people be like, hey, look at my shoulder blade. Look how it wings out. Isn't that neat? Not too neat, actually. It's something that can create a lot of issues in your shoulder. It can create a lot of issues in your back, and it can create for a lot of chronic pain. So we'll get into that a little bit more. But what this allows for is something called scapulothoracic rhythm. Big word. Don't worry about what it says. Basically, this slide is a little confusing because it says scapulothoracic rhythm here, and in this little box it says scapulohumeral rhythm. All I want you to take away from this concept and this slide is essentially our bonus question that's down on our page here. Do the shoulder blade and the shoulder work together? And, you know, I've got some funny answers there just to kind of, you know, make it fun. But of course they do. You can see when this gentleman is bringing his arm up, the shoulder blade is moving about 60 degrees this direction. I don't really care how many degrees it's moving. When I'm treating patients, I'm not looking with a goniometer to see how much, but I'm just seeing, hey, is this shoulder blade doing its job while the actual shoulder is moving? And so when we get into a little bit more of the scapulothoracic rhythm, that's being able to maintain that shoulder blade nice and flat on the rib cage. So this, you can see how you have the ribs that are playing a part. You have the shoulder blade that's playing a part. And it allows you to say hi to someone and gets you to be able to throw a baseball, hammer a nail in the wall. And so basically it's showing that it's not just that ball and socket. It is everything. And that is a big concept that I just love to really get home to a lot of people. If I could sit here all day and tell you anything, this is the biggest component that I want to let you guys know about, okay? So moving forward, we have our movement musculature. You can see I don't have as much information about this because these guys are important. They really are. What their goal is to help you move. So when you are doing your front and lateral raises, when you're doing your lat pull downs, all the stuff that you have equipment for in the gym, that's awesome. You know, strength is super important. These muscles are meant to help you move while you're doing any activity throughout your day. And so that's why they play also an extremely important role in the shoulder. But you can see though, look how big these muscles are. This is, first of all, this is our upper trap, mid trap, and low trap all put into one. That is a massive muscle. The deltoid, massive muscle. Our lats attach all the way down to our hips, guys, and they attach to the arm bone. These are huge muscles. So strengthening them is something that's super easy to do. You go on a machine and you strengthen them. And so a lot of people think, okay, I have shoulder pain. Let me just do some delt raises. Let me do some pull downs. And that's gonna be all I need. That should help. And I'm gonna be here to tell you the concept of why you just need a little bit more than just addressing these muscles. So I'm just gonna go through a super quick concept with you guys that I just tell literally every patient I see with shoulder pain. Basically, you've got movement muscles, you got your stability muscles. I've made that clear so far in this presentation. I like to describe them as being like a play, like you're going to like a Broadway musical, right? So you have your main actors on screen, on the stage, doing their thing, right? Those are your movement muscles. Those are the guys you're seeing. That's the thing that's being displayed to you. What your stability muscles are is your stage crew, the light, the sound. And those guys don't get as much recognition. They're doing their part, but you're not seeing what they're doing. And our stability muscles relating to the body help keep our skeleton upright. They help support every single position you're in while the movement muscles are doing their thing. So when you don't have a stage crew, when you don't have those things, and you just have the actors on the screen and on the show, you're not seeing them. It's a whole hot mess and a half. So that's why the concept of needing one and needing the other is super important. And so what we're going to do is when we go through our causes of shoulder pain, I'm going to show you how that's really going to relate with those stability muscles not doing their jobs. So any questions so far? That's the biggest concept I want to hit on. Really kind of, you know, can be a little bit to take in. So I can definitely answer questions about that. But I'm going to continue to move forward talking about our common causes of shoulder pain then, okay? So what I want you guys to do when you're following along, the boxes have, things for 4 causes of shoulder pain and 5 common pathologies. Pathologies mean problems, things that, when you go to the doctor or more or less going to a physical therapist, they're going to be like, you have this. That is going to be your pathologies. What I'm going to talk about first are causes, things that are causing, things to go wrong. Okay. We have a comment. Hang tight. Oh yeah, I can certainly email the slides. That's not a problem at all. We'll definitely do that. And then also, again, if you guys didn't get the handout, basically the handout and the slides should go together because everything we're talking about is kind of coming from my brain and coming from here and not completely written out on the slide. So having those both together is going to be really important. Okay, so common causes of shoulder pain. Thank you for your question. All right, first concept, and this is one that most people are going to experience, is called upper cross syndrome and poor posture. Basically, here's what you take away from it. I'm going to move my little camera so I can see. Look at the guy on the left. See how he has perfect posture? Nobody in America, right there. So basically, when we have poor posture, what's happening is we're developing this syndrome, which is super fancy named by a gentleman back in the day who came up with this brilliant concept. But basically, we're creating a cross of muscle imbalance. So if you don't even look at your muscles, drop those from your brain for a minute, you see the word weak. You see the word weak. See the word tight. Tight. You guys get the concept here. It's crossing. So what's happening is we're developing muscles, and you guys can tell me, you're like, oh yeah, these muscles are really tight on me right now. Our upper traps sitting up and through here. You can see this gentleman really, really kind of hunched up like that. Then we have tight pec muscles in the front where we're drawn kind of just like this. So when those muscles get tight, and then in addition, our neck muscles in the front here, see how his head is so pushed forward? These muscles can't even support and they're super weak. And then our lower traps, our serratus anterior, that important muscle I was telling you guys about earlier, is weak. We get into this gravity positioned poor posture, and it is like the baseline of where all our shoulder problems begin. It is a huge concept. So if you're one of my shoulder patients already, or you've been to PT before for shoulder, you'll notice you're working on a bunch of different things to address the weakness in these muscles. You're addressing the tightness in these muscles because we need to address the imbalance. Because when we don't start with that, it's really tough to make progress. And so, and by the way, I'm going to show you guys all great exercises to address these sort of issues, okay? But this is something kind of, starting package, baseline, big problem of our issues. Okay, so that is one cause. Another cause is rotator cuff insufficiency. What I mean by insufficiency is basically that just the rotator cuff isn't doing its job. And what's its job? That's my question for you guys to fill out there. It's on your sheet. We've talked about it before, but essentially for those of you coming in late, it is keeping the golf ball on the golf tee. It's keeping the ball of the shoulder, of the arm bone, onto the shoulder blade. So what happened, when the rotator cuff doesn't do that? Let's say it's weakened. Again, because we don't do rotator cuff strengthening at the gym. We just don't. We don't know how to. And so when it's inefficient, what starts to happen is now the ball on the socket starts doing whatever it wants. And so we'll talk about what kind of impairments that creates later. But essentially, that is another cause as to why we have issues with the shoulder. All right. This picture is super dramatic, and I just couldn't find a better one. But basically, we're talking about hypermobility and instability. So this can come, and so the easiest way I can put this is that the shoulder blade just moves to, or the shoulder joint and the ball on the socket moves too much. Your capsule is loose, your rotator cuff is weak, and it just moves too much. It shows this shoulder like blatantly dislocating, and we're gonna get to situations like that, but to get a little bit more detailed as to why this picture would demonstrate hypermobility and instability is when you dislocate your shoulder, you're simply bringing it out of the socket and back in. And so it kind of disrupts that capsule and it makes things super, super tough to function. When you have something that moves too much, it makes it incredibly difficult to help sometimes. It's possible, but one concept that I learned in school, and I keep it with me, it's a lot easier to get something that's tight to move more than it is from something that's already loose to become strong. And we'll get into that a little bit more a little bit later, okay? But basically, concept moves more than it should. We have a question.
That was me, but I don't know if you missed a question from Sabrina that was a little earlier.
I'm looking. Yeah, no, so like I said, I'm going to answer all of those actual pathology questions a little bit later in the chat or in the end of the presentation. Those actual specific questions on shoulder pain, I'm going to get there. But I'm trying to lead up to those kind of those things. So Sabrina, hang tight. I will get to your question. Don't you worry. But I just want to kind of get the concept of these causes down first, and then we will totally get as to why that will relate to you personally, okay? So the last thing that's a cause here is, you know, an injury. You know, I mean, this is more getting into your like dramatic dislocations, you know, rotator cuff tears. It, you know, something, you know, you're throwing a shoulder blow or throwing your shoulder, throwing a baseball, throwing your shoulder out, diving into a plate for home base, throwing it out, lifting a ladder and, you know, feeling a little completely click in your arm. That stuff all happens. And what it is it's a big kind of acute injury that is a cause of shoulder pain. So what I want you to take away from this slide is the first four things are more kind of chronic, degenerative, just kind of changes in our body. This is a legit, you were in a car accident, you had something happen. So that's the concept I want to take away just simply from this slide, that this is just another cause of something that can, you know, I think it's pretty obvious that it would cause shoulder pain. So I want to get into what this I'm going to tie it all together right now with what this all results in, okay? Before I do so, let me look. Oh, no, not quite yet. I had one more bonus question, but I'm saving it for later. Okay, so the very first thing that you're going to hear about, and honestly, most of my patients have this issue, is impingement syndrome. And what this is, oh, I'm going to come back to the chat in just a second. I want to explain this real quick. So impingement syndrome is when simply that arm bone is not staying nice and congruent. It is coming up and it's pinching stuff. So basically what's happening is when we have rotator cuff weakness, when we have that poor posture upper cross syndrome, or even something, you know, coming from shoulder instability, basically three of the things we talked about earlier can cause impingement syndrome. Basically, you're having structures becoming pinched. So example, this is a tendon, specifically one of our rotator cuff tendons that's being pinched because this arm bone here is crushing right up into it. In addition, you see this a lot with the biceps tendon. So our nice little bicep muscle here actually attaches to the very top of that golf tee. And so when you go, sometimes for all you people in the front here who go like this and you're like, oh yeah, that's painful. What's happening is there's some sort of impairment, whether it's the rotator cuff weakness, upper cross syndrome, you name it. It is going to go ahead and pinch that structure because instead of coming here, it's coming up here. And so that's why we get a lot of impingement. And this is seen with a lot of stuff overhead, a lot of stuff bringing to the back. It's basically stuff getting pinched within that shoulder joint. And that is something that is a big cause from a lot of impairments and causes that you're seeing before, okay? Was the fourth before injury? Mel, I'm really sorry. I'm not understanding what the fourth is. So if you reword that, I will totally get back to the question. I'm really sorry here. But I'm going to move forward. So that's a big one. That's a biggie. When you have stuff happening there, like from overtime, and that's you guys or people that are like, man, I don't know what caused my pain. All of a sudden one day I'm reaching for my coffee mug and yeah, that didn't feel great. And so that is a big thing that is common in a lot of people. And really, and I want to show you guys something real quick. And this is something a professor might show me back in the day. When we're sitting with nice upright posture, I want you to see how far my arms can come up. Okay, we're here, nice and tall. Now, nope, I need it there. Oh, sorry. Paula's moving my screen on me. So now if I'm sitting with super poor posture, and you guys try this for real, like try this while you're sitting here. Look how high I can bring my arm. Like I'm losing at least 30, if not 40 degrees of movement here. So when we're all sitting like this, this actually hurts to me, and I don't even have impingement syndrome. But what's happening is that arm bone is just slamming right into that shoulder blade, right at the top. If you guys look at my mouse, right in here. So you can see how that's an issue. So when we improve these things, look at that. It's crazy. So concept that's just a little more visual, that kind of makes a little bit more sense than me telling you guys big words and why it's happening. Okay. So I'm going to move on to the next one. What is the fourth cause of shoulder pain? Yes, I'm sorry, Mel. Let me go back to that for you super fast. Our fourth cause of shoulder pain is that instability concept that I was talking to you about. And we'll get a little bit more into detail when I talk about what these result in. The instability is when that shoulder blade is, or that shoulder joint is moving more than it should. Instability. So, well, I'll go into that concept a little bit deeper, but that is your fourth cause of shoulder pain. Okay, so rotator cuff tendonitis and chronic tearing. I guarantee you, if we all got MRIs right now, it would show that we have rotator cuff tendonitis and chronic tearing. A lot of time, people see this on their MRI and they're like, oh my gosh, I need surgery. No. A big concept that's coming out lately is we are not our MRI. We all are going to start seeing degenerative changes after the age of 30. I'm 28, so I still have 2 years to go. So lucky me. But for everyone else out there, you're going to see these changes. You're going to see that one day that your MRI of your shoulder might say rotator cuff tendonitis. And it's going to be like, oh my gosh, or I have tearing of it. Oh my gosh, it's terrible. Yes, but not. It's something that, and I'll get into that a little bit more when we get into if you're having these issues, when to come see physical therapy. But honestly, it's due to kind of that chronic impingement. It's basically this over a longer period of time. And so what happens is that chronic pinching is just causing fraying. It's causing tearing. It's causing, and to get a little bit more, I'm sure all of you have heard of tendinitis, but no one really quite knows what tendinitis is. Basically, now remember from way back when we started, when I said that a tendon is when you attach muscle to bone. So that's that white content right here. It's nice and strong, and it's meant to hold everything in place where that bone is attached to that muscle, and it creates movement. Long story short, it's inflammation of that tendon. Itis in Latin literally just means inflammation, irritation. A lot of times if you guys are getting, I'm sorry, cortisone, I almost said steroid, but it's cortisone injections. Basically, cortisone is meant to be an anti-inflammatory. So when you go in and inject something in the shoulder and it causes pain relief, it's basically taking that inflammation away. But then honestly, it's a little bit of a band-aid because you're just taking away the symptom. When our true cause is weakness, tightness, everything that I've been honing on this whole time. So that's when you're going to find a lot of those type of situations occur, is more of a chronic situation. No, so not quite. I'm looking at the chat here, guys. Someone's talking about Hylogen injections. Not quite. I'm talking more about cortisone, which is kind of a type of, well, cortisone is actually kind of a hormone that we have in our bodies that they naturally make. But essentially, it's something that's being injected. A lot of doctors will be like, let's get a cortisone injection to help with the pain. And basically, it's just to help that itis or that inflammation. But I'll go into that a little bit more later. But that kind of makes sense. A lot of times this is happening with your reaching up, reaching out to the side. And what external rotation is kind of reaching back, kind of like this, coming out this way. Okay. So moving forward. And I do apologize. So I didn't know this said frozen shoulder. I thought it was the frozen tundra. I'm a Green Bay Packer fan, guys. And so, you know, if I didn't have something related to the Packers in here, I was going to be very sad about myself. And I don't know why these little red lines are appearing on the PowerPoint. And I'm really sorry that you guys have to look at that. But anyway, so frozen shoulder. This is a impairment pathology that can be really hard to understand in the sense of it's tough. So we have 3 different phases of this frozen shoulder, but basically what it is that capsule we talked about like a million slides ago is super, super tight. And it's almost suffocating the shoulder joint. So now when you try and move, you can't. And so you can see that this is a normal shoulder joint on the left, and on the right, you have a super inflamed shoulder joint that's being super, super just tightened and mad. This is something I see so many frozen shoulders, and all of them are different, but they're different in the sense that they're always in different stages. So we have the freezing stage. That is when, and I just put this nice concept on here, pain is going to increase and your motion decreases. This is where it's like, okay, this is unbearable pain. This is super stuck. I can't move it. That stage lasts a pretty long time, a couple months, honestly. Frozen stage, this is probably the longest stage of them all. And this is honestly the stage where I see most of my patients in, where we don't see a lot of change, I'll be honest. Pain is decreasing, but your motion kind of remains the same. So it's like, okay, it feels better, but I still can't move. That part takes a long time as well. Thawing is finally when it's like, oh my gosh, okay, I can do things again. This is awesome. One thing that if you have frozen shoulder, or if you've had frozen shoulder, you know, it takes time. Sometimes this can take up to a year to kind of calm down. And basically, you know, it's one of those things that when you come in for therapy we kind of help get that process going along a little bit quicker. But essentially, you can't have the freezing stage without having the frozen or the thawing. It comes as a package deal. And it sometimes can be a hard concept to understand. And it's something that does take time, but with exercise and kind of maintain what you have can help kind of the process speed along a little bit quicker. Okay. All right. So this is coming from the question before about what our fourth common cause was, and our fifth one being an impact injury. So these are things, and this is going to go like when we talk about our causes, this is causes or not causes, I'm sorry, our pathologies. This is kind of 4 and 5. We have shoulder dislocation coming from, coming that instability thing. And then we have rotator cuff tears, and I'm talking like an acute, full-on tearing all of those tendons, rotator cuff tears. That requires surgery. That certainly does. But don't confuse that with chronic tearing. This is something acute. You go to lift something that's 100 pounds, you feel a big old pop, can't move your arm, can only do something like this. That is when you're having like an impact injury, which is a chronic rotator cuff tear, for an example on that point. Then, shoulder fractures. One fun fact for you guys is the most common place for a fracture of the arm bone to occur is right here at the neck. We call this the neck. So we got the head of the shoulder, right? The ball in the socket. This is the head. This right here is the most common spot for an arm to fracture. And so you can see how close to the joint that is. It's a rough stuff. Obviously, most of the time, resulting in surgery on that too. Last but not least, and this is one that is a little bit more difficult to A, diagnose, B, really see, is a labrum tear. And this is something I haven't really touched on quite yet. But basically, when you have your ball in your socket, and this is the same for the hip joint, and this is similar for most of really all of our joints, we have a ring of cartilage that sits right along the outside of that golf tee, right? And so basically what happens is if you dislocate your shoulder, or if you do something to jam that ball into the socket super tough, anything where you're falling on an outstretched hand, boom. What happens is you can create what's called a labral tear. And depending on where the labrum tear is, it has a different name. It has a different name. At the top here is a slap tear. We got a Bankart lesion over here. We have a reverse Bankart lesion over here. And don't worry about that name, those names. It's more for, diagnosing purposes for practitioners. Sometimes can result in surgery, some cannot. I have a current patient right now, full-on car accident, huge labral tear, and we're trying to keep her from having to have surgery. So, and what are we doing to make sure she doesn't is doing home exercises and coming to therapy for exercises. And so I want to talk to you guys now about the stuff where you're probably going to be the most interested in right now is what can you do at home right now for your pain? And I'm going to show you some key home exercises. Now, there's a million exercises out there. There's a million great ones out there. I just kind of went through and picked my top favorites for you guys, okay? And so when you follow along with your handout, you're going to see that in your boxes, I named all the exercises because I wasn't going to have you guys try and think and remember, okay, what was the name of that one? But I want you guys to write down the important part, which is like, what is it for? What is its purpose? Okay. So what's going to happen is I'm going to go through these, and then I'm going to switch the camera here, and Paula is going to show me going through a couple of these exercises just to get the concept down. And of course, if you guys got questions on them, we'll review it. So first and foremost, so you remember that serratus anterior or that muscle I had a whole entire slide on, keeping that shoulder blade suction cup to the rib cage. This exercise is essentially serratus wall slides, and with a band or even without a band, is something that is going to improve your scapular stability. Keep that suction cup nice and strong. And so basically, and again, I'm going to go through these so you guys don't have to worry if, you know, I'm just going to explain it very briefly and then show them to you, okay? But basically, this gentleman's sliding this arm up, coming back on down, and with a band giving a little bit of what I like to call lateral resistance, helps kind of engage those muscles, okay? This one's my favorite name, No Monies, which is like most of us that have a high student loans. So basically this is just really good external rotation activation and rotator cuff stability exercise that I love to give patients who are maybe experiencing those impingement syndromes, the rotator cuff weakness and insufficiencies, and instability. Because kind of touching back in on that instability concept, even though it is harder to make something looser and then become a little bit more stable, basically it's tough, but you can do it by improving your rotator cuff strength. And that's the biggest thing. Keeping that golf ball on the golf tee, getting those muscles to fire is exactly what this muscle is going to be doing. And this is the exercise that's actually on your 10 burning questions. One of a really good important one, and I stick to it all the time. It's fantastic. All right. Oh, we have a question. Hang tight, everyone. You're doing great so far. Thanks for staying with me. Yeah, no, we will be, don't worry, Martha, we'll be emailing those exercises to you, and it has, you know, pictures of the exercises with them, so you'll know what to do, okay? Oop, I skipped ahead. You'll have to forgive me. Okay, rows. Everyone does, you know, it's heard of rows, essentially, right? And a lot of people do them very incorrectly. And so biggest thing with them, and this is why I'm going to go through it a little bit with you guys momentarily, but it's mainly to improve our middle trap and our lower trap, our middle actually, but then a little bit of these guys where you're kind of pulling your shoulder blades down and back, those muscles for activation. And that is super important for, hey, remember we talked about when you're sitting like this and these muscles are weak? That's improving that. Those are super, super important to engage in. So standing rows, this woman is doing kind of a partial squat. Always good to do. Get those legs involved, core involved, but also just standing with upright too is completely fine. Okay, so you'll have to forgive me. I changed an exercise last minute because I just wanted to. So on your guys' handout, it shows like ball circles, and yeah, it's great, but I decided to go over a different concept. And these are called Y's, T's, and W's. Okay, we'll go over them. But basically what you're doing is you're activating your middle and low trap muscles. And so to kind of get a little bit less confusing with our trapezius muscles, we have an upper trap. That's this guy that's super tight. And then we have a mid and low trap. And those are the ones that are stuck here like this and super weak. So most of the time we have an upper trap that's too tight and middle and low trap that's too weak. And so these particular exercises are meant to kind of improve these type of these muscles to help with stability and honestly more posture than anything. So when it says to improve middle and low track activation, really it's to really improve posture and stability of that more concept with that. Okay, sweet. And of course it's similar to the YMCA, but there's not a dance to it, so it's not as cool. But anyway, I like to think I'm funny through these things. All right, so going back to a question that was put in the chat earlier with how the spine is involved. You know, guys, I only get an hour with you, so it's tough to cover everything. But imagine, with that poor posture, we have a very rounded spine, right? I'm just gonna sit and do this all day long, right? So when you have a rounded spine, honestly, our spine and our mid-back, which is called our thoracic spine, because our neck is our cervical spine, our mid back is our thoracic spine, then our low back is our lumbar spine. When that thoracic spine is super, super tight and the joints themselves aren't moving, hey, we just contribute to this poor posture more. Hey, what does that do? Same problem. We can't move our shoulders well, and we create problems down the road. So big 2 exercises I'm giving you guys here. I added these 2 together because, I decided to. These are called open books and thoracic extension. I'm going to go over these in a little bit more detail, but they're super, super great for opening up that thoracic spine and making sure your rib cage is also moving along with it very efficiently and thoroughly. So thoracic mobility, upper back movement, that is what these are improving, okay? So cheerleaders. I was not a cheerleader in high school, for those of you asking. I was a basketball player, but I like this exercise anyway. So basically this one, again, is it's kind of engaging those postural muscles. You can see a trend here, right? We're doing a lot on posture. We're doing a lot on posterior muscle strengthening, because that is kind of the premise and one of the biggest components to kind of get in with that. Oh yeah, so you can definitely use I'm sorry, I'm looking at the chat for those. I apologize. I get a notification. And the question is, can you use very light dumbbells for the standing rows instead of the band? You can, but you have to change how you're doing the exercise. And I'll go into that, okay? Just remind me if I don't do it in our demonstration, okay? But light dumbbells are just fine. You just got to change how you're standing. All right, so cheerleaders, I'm going to go over this one specifically, but basically we're engaging all those kind of postural muscles in the back again. Okay, so now we had a question earlier about the neck. Yes, the neck is so important. And it kind of goes along with that upper cross syndrome thing, where when our neck is super pushed forward, these muscles are so, so weak. And so a lot of times you will see people paired having shoulder issues with neck problems because their neck is not stabilized. You know how I told you before that the shoulder joint's very movable? Well, our cervical spine is very movable too. It's meant to move. And a lot of times when you don't have the strength to have it being stabilized, it can cause all sorts of issues kind of going down to your shoulder and up, and even shoulder stuff up into your neck. And so this is kind of looking at how everything's a little bit related. So these are called chin tucks. And basically, if you look at the picture here, this woman is kind of, and I love having the 2 fingers on the chin concept, because you're kind of drawing your neck. I call this low key, I call this the double chin exercise, which I don't need to do this exercise to have, but what you're doing is you're just drawing this down and back, and you're engaging these front neck muscles, and you're holding for about, I'm not going to talk like that because that's tough. You're going to hold for about 5 seconds and you're going to relax. This one's meant you'll feel kind of the muscles in the front, but you also feel a little stretch in the back because those muscles are kind of tight back there from being in this pushed out position for so long. So more on that a little bit more. And there's also progressions to these exercises. And that is something, you can always contact me in the future with questions about that. And then, I saw a question about emailing the handouts. Yeah, absolutely. We can email the handouts. Those should have been available for you guys from the get-go, and I apologize if they were not. So this coming into another stretch, because along with strengthening, getting the muscle stronger, the weak muscle stronger, we need to get the tight muscles also lengthened. So this is a doorway stretch, and this is something you can do in a corner. This can be done in a doorway. Hey, look at that. You can, what it does is you're looking to stretch these kind of chest muscles, these pec muscles that are super, super rounded and super, super tight. And so that really is to improve that pec muscular tightness in order to, hey, look at that, improve posture. See what I did there? All right, so those are big exercises. There are so many more, but these are the main guys. What I want to take to now is to have Paula kind of go ahead and follow me around while I do some of these exercises for you guys. You kind of can see how they're like doing in motion, okay? So hang tight, we're switching screens, and you guys are following me around the clinic. So I'm over at our Swan location, usually. Right now we're at our Tinker Verde location over at Tinker Verde and Sabino Canyon. We're hanging out here today with you guys, so go ahead and follow me around. There's Miss Paula. Hello. I want to start with the rows, okay? Because basically, these bands can be a little bit tough to have if you don't have these at home. Honestly, Amazon, very cheap, you know, good investment. But essentially what we're doing here is when we're doing our rows, we are, and what I'm going to do, Paula, could you stand more right here just so you can see and then turn it towards you? Yeah. We are bringing our shoulder blades down and back with this exercise. Biggest thing a lot of people do is they try and go, kind of bring those elbows back, draw those shoulders up. We're feeding into the pattern we don't want. So basically what I want you to think is your shoulder blades, everything I'll say with every exercise, shoulder blades down and back, like primero position, okay? So what you're doing, arms straight up, squeezing those shoulder blades down and back. So my upper traps are not trying to engage in this exercise. They are simply relaxing, and I'm engaging the muscles that are in the back here, squeezing, okay? So that is something that is going to be really, really important. And I vary this exercise. I do here to extension. I do all sorts. We can do high rows coming down. There's variants to it. And we can talk, for those of you who are interested in those, we can talk about those later or email me. I'll provide my email at the very end of this. Okay, dumbbell question. Let's come on over here. So question about having light dumbbells at home. Let me just grab some here. Okay, so basically, if you're doing this with a dumbbell, you're not really getting the resistance where you need it. So here's what I recommend for you guys who have dumbbells at home is have a table, have something with a surface. And what I want you to do, what we're gonna do is kind of bent over rows because everything needs to be against resistance. Here, not really against resistance. And you'd see if you try. Could you stand here so you kind of go more side view?
No.
Okay, thank you guys for bearing with me. Kind of pulling straight up, that's good. Pulling straight up against, back down. So that is a great way you can do that. Then you can even kick it back. You can do all sorts of fun stuff with this one. So that's perfect. All right, I want to get to some of the wall exercises here. We're gonna grab a band and we're heading over to the wall. Hang tight, guys. I gotta find one more band. Paula, we have a question in the comments if you don't mind.
Okay,
saying that.
I'll read that for her. Let's see, will these exercises work if I still have pain following arthroscopic shoulder 6 months ago?
Oh, heck yeah. Excuse the half bad language there. Marilyn, we'll talk about that. That is something, arthroscopic surgery is something that, you know, none of the structures are hit. It's usually kind of a cleanup of the shoulder. And so a lot of these will be fantastic for you to do. Only if you're not having pain with them. That's the biggest thing, guys. So I'm gonna have you follow me over here. If you have pain with these exercises, don't do them. I don't want you to grit your teeth and push through them. That's not going to help your pain. So for any reason, and it could be, you know, the exercise is being done slightly incorrectly, or, you know, maybe it's aggravating something that's going on. And that's when we'll talk about that later, is when you've got to go see someone like me to see why that's happening. Okay. So Paul, I'm going to have you go right here. So here's these wall slides. Basically, my arms are here. I don't want my elbows out like a little chicken wing. I want my hands out, kind of doing like touchdown Packers, right? So here's what's happening. A little bit of lateral resistance into this band. So these loops, these are just kind of tied ones we have here at the clinic. If you go on Amazon and type in circle resistance bands or just loops, I saw the other day that there was 5 of them for $5. So all 5 of those bands for a total of $5. So something that could be very beneficial for you guys to look into. So what we're doing, looking straight forward, basically I'm finding a spot on the wall. Okay, I don't want to follow with my neck up because that's going to hurt my neck and I don't want that. So you're here, you're sliding slowly, the arms all the way straight, and you're sliding it all the way down. We're coming up again, and we're coming down. Now, that's all I'm demonstrating because that is hard. So basically with a lot of these two, around 2 sets of 10, 2 sets of 15 would be appropriate. I know that's probably a question that's coming. So, all right, so next, we have those cheerleaders. So I'm gonna go ahead and send it here, Paul, actually. Thank you, ma'am. You are going to have basically my stance against the wall. Here's what I like to tell a lot of people. My back is flat, but then Paul, look at my feet real quick. Sorry, Paul is doing a really good job.
I'm trying.
She's trying so hard. Basically, my feet are far away from the wall. They're not back here because then my back is arched and that is uncomfortable. So I'm almost going into like a pre-wall sit position. So being here, good. So now my back is flat, my shoulder blades are down and back, hand grip is an overhand grip. What we're doing is we're keeping elbow straight on this one. And the picture will really, really help with this, okay? So you're bringing this back here like this, and then you're coming diagonal, bringing it back here, bringing it here. If you want to have some fun, you can hold a chin tuck in this position. Hey, look, 2 birds with 1 stone. That's always fun. All right, so what I usually tell my patients that are doing this exercise is every time you go through each one, so that's 1, that's 2, that's 3, that is 1 repetition because you're doing each one of these once. And I usually go through it about 5 times in total, okay? Now to the no monies. The rotator cuff expert exercise here, shoulder blades down and back. Instead of having that kind of pronated overhand grip, I want you guys to have a supinated kind of hands up grip. Here, what we're doing is we're pulling this out to the side, and then we're coming back. Out to the side, coming back. What a lot of people will do to kind of compensate is they'll go into shoulder flexion down here, or I'm sorry, into elbow extension. That's my bad. I haven't had my coffee yet today, guys. So essentially, see how much this is incorrect. The elbow bend needs to remain the same, not this coming down here. I need this. So big concept. I would say coming right above your belly button right here, make sure that that band is hitting that every time. If it goes below your belly button, you're doing it wrong. And so that's how that one looks. Okay, last one I want to show you guys in a little bit more detail are our Y's, T's, and W's. The YMCA. There is a advanced version to this that I really love, but I feel like if I go through it all with you guys today, it's going to get confusing. You're going to be like, what? So here's what I want to show you. Back against the wall. And it shows that person in the picture kind of being in a kind of bent over position. There's nothing wrong with that. That's fine. But to start off, I want that back against the wall. What I want you to do, we're coming into a Y, bringing our arms up to the side. Now, biggest thing is I'm not doing this. You bring it down. Extending my low back. That one's tough. What you're doing is you're making sure by having that back against the wall flat, you're just working those shoulder blade muscles. Now you can see I have a hard time. Like, I'm not just going. I am keeping everything stabilized. And this is truly me having a hard time bringing my arms up because I'm thinking, not letting my shoulders lift. I'm thinking, keeping the shoulder blades down and back, and it's tough. So doing that against the wall is going to be very beneficial. I see a lot of people commenting in the comments, let me get through these and we'll go through those questions. Okay, I promise. So we're coming up. This is our Y. Okay. From here, I actually want you guys to keep this position, okay? Because then we're going here to our T. Coming here. So you can kind of just bring your arms down into that T'd position here, okay? Then we've got the W's. So basically, you're making yourself a giant letter. You've got your Y to start. Hold for about 5 seconds on these 2 guys, okay? You'll feel the burn if you're trying these with me. Yeah. I even like to go down into a touchdown Packers position. But then more that T. And then to make your W, it's super simple. You're just bending your elbows down by your side. And then you're relaxing. Yeah, that's tough. That's tough for someone who doesn't have shoulder issues. So, I mean, that one is a really good go-to to kind of engage those muscles. Now, I want to show you guys the thoracic extension with just using your normal dining room chair real quick, okay? I tried to pick things that, I tried to pick things that were going to be simple for you guys to perform at home without needing a large gym. First of all, you don't need it for these stability muscles. Second of all, just a little bit easier. Scoot back just a little bit so you can see the top of the chair. So with this one, placing your hand, always support your neck. Supporting your neck, super important, okay? What you're doing is you're just very lightly, and I'm not cranking my back. We don't want to do a whole chiropractor situation where you're trying to get all the pops in the world. If you feel your back pop, that's okay. But if you don't, that is also okay. So what we're doing is we're just looking for that stretch, okay? So we're here, and we're just very lightly leaning over the back of the chair. And if you're in a chair, try this right now. Biggest thing I want you guys to think about, though, we're not extending here. So if you find your low back lifting off the chair, you're just going to give yourself back pain, and then I have to do a back pain module, and, we don't want to do that. So I just want you to think resting on the backrest and then leaning over the back of it. And you can target different areas by, you can slouch a little bit, get a different area of your back. That's a great way to do that. Last but not least, I want to show you guys our open books. Okay. Let's go to this table. Paula's doing great. Just, me following me around the clinic here. So basically, I want you, could you come from this?
Yep.
So,
Hey guys, taking you around the world.
around the world, around the clinic, around the clinic. So I am here, I'm laying on my side and I have my knees bent, okay? Which you can't, and that's okay, you don't have to show that, it's not that important, but
Okay.
I just don't want your back or your knees straight or your back's, I want your knees nice and bent. So arms are out to the side. Here's what I'm looking for. You are bringing this arm around this way. Now, that's how I'm going to demonstrate it. Here's what most of you are going to do. Because you're still, well, and that probably, you're still, yeah, we'll take that away. Thank you, Paula. Because what's happening is you're thinking just the arm is coming, right? So what I want you to think about is it's more an upper back movement. So the difference between this and this is because I'm having my head follow it. So I encourage you guys to watch your hand. So watching it open is going to get you that movement versus if I stay here looking at you guys on the Zoom, I'm just going to crank my shoulder and it's going to hurt more. You don't want that. So basically that open book, that's good, let's take this back. That open book exercise is meant to allow for more thoracic movement. And that is going to be really important with improving some of those structures that are tight to help address the other structures that are weak. So before I get to your guys' questions, one thing I just want to, send your way is, addressing pain is more than just getting massage to it or trying to, loosen up the muscles that are staying super tight. If you just address one portion of the imbalance, you're not going to change the imbalance. So the reason why I'm giving you these exercises, the reason why I'm going into such detail is because I want to just bring the concept home that it is lengthening the muscles that are tight and it's strengthening the ones that are weak. And so when we kind of dig into that combination, honestly, you can address almost any shoulder issue, any, let's say, non-major shoulder issue. Now, if you come to me with a full rotator cuff tear, I'm going to be like, I'm really sorry, I'm sending you to the doctor. But you can see, like, just with chronic shoulder pain, chronic back pain, neck pain, all kind of tying together, addressing these issues accordingly will really help. And so I really try and hone in and let people know that with physical therapy and these kind of concepts, we can address this pain with just these very simple concepts. And that leads me into when you cannot, can we screen I'm putting the presentation back on, okay? When you go through all these things, and this one right here, and you still are having issues. And so I saw some comments in there like, what if I'm still having, what if I'm still having problems? Basically, what I want you guys to do is really come and chat with one of us. So basically, a lot of people don't really know exactly what physical therapy is and what physical therapists do, but think of us as like the movement specialists. Like our goal and our concept is to get you moving better, fix the impairment, so then the symptoms will improve. A lot of our concept lately with, just Western medicine is give you medication, inject you with stuff. And that addresses the symptoms, but coming to see us addresses the cause. So giving you guys this knowledge, this information is my goal today, to bring you a little bit more information on why shoulder pain occurs and why some things you can maybe do about it on your own. But let's say it's a little bit worse and it continues. Hey, come see us. At all of our 9 clinics here in Tucson and now our new clinic up in Tempe, we do free consultations. And basically you're getting some time with a licensed physical therapist like myself, and you tell them about what's going on. You give them everything that you're going through, and they sit there and they will listen, and they will, come up with a plan. If they think physical therapy is for you, then we can schedule an initial evaluation. Kind of, it gets to the fun part of insurances, referrals, but essentially, honestly, you'll get you'll get to talk with a movement expert to know, hey, what do I need to do about my shoulder pain? And so that is what our free consults are for. That is something where you can learn additional information about what's going on specifically with your shoulder. And that is something that I think really everyone should consider looking into, even if you have other pain in parts of your body. The free consult is a great way to learn more about what you need. And so I'm going to leave it with that. I know you guys have a ton of questions. I see 15 things in the chat. This is my dog, Maverick. She is my favorite thing in the whole world. And so I'm going to show you guys a picture of her while I address your questions. So I'm going to head to the chat. I am going to start with you guys who were asking me some questions way in the beginning, okay? So let me just make my chat box a little bit bigger. You know, thank you guys. I just want to thank, before I answer questions, thank you guys for coming and hanging out with me today. I know I ran a little bit long. They asked me if this was going to be over an hour, and I said, nah, definitely not. It was. So if you guys got to go, totally understand. But I am here to address your questions next. I'm just going to kind of make this a little small. Okay. No, that's okay. And so, like I said, and then also, I didn't put this information in here, but I'll drop it in the chat. I want you guys to have my email and also the phone that you can access with me over at the clinic. Okay. So I'm sorry. I'll put it in. Oh no, that's good. Let me answer the question. I'll put it in at the end. Yeah. So okay. So here's what I'll do. I'll drop that information real quick. Okay. So my name is Bridgette Darton. And my email, I will drop right next to it, okay? Don't worry if it says Golden Bear versus Body Central, all the same right now, okay? And then I'm dropping that phone number in there too. So I will tell you that this phone number is kind of reached at all of our therapists at the clinic will be able to answer from this line. We don't have personal extensions anymore, but if you go ahead and call that, or even our front desk, and you say, hey, I have a question for Bridgette about shoulders, be like, cool, let me go grab her. All right, so that's in there for you guys, okay? So going back to the top, and again, hang out if you want me to answer your questions, and if not, you know, I hope you guys learned something today. My goal was just to give you just a little bit more knowledge about the shoulder, and hopefully that'll help you guys, lead you into feeling better. And if not, now you know what you got to do if you don't. So it was great hanging out with all you guys. Never done anything like this on Zoom before, so I appreciate you guys, you know, hanging in with us. All right, so coming to our first question. If I can.
Hey, Bridgette, did you put your information to everybody? Because I don't see it in the chat box.
I did put it in for everybody, yes.
Okay.
But let me, I will double check that in just a moment. Okay, this is coming from Liz. Does pain between the shoulder blades involve the shoulder blades that could be done, could be from the neck, ribs out of place? So Liz, I hope that the presentation kind of maybe helped answer your question on that a little bit, but essentially, yeah, I mean, if that shoulder blade is not moving over the rib cage appropriately via if the neck is having some movement issues or the ribs are a little bit stuck, and ribs being out of place can be just more, they can be a little bit maybe displaced in a, you know, in a little bit. Ribs don't move a whole heck of a lot. And I'll be honest, if we all were cadavers today and we all looked at all our rib cages, we'd all look different. But essentially, yeah, pain between the shoulder blades can be involved from, you know, not having that rhythm move over very well. And it can also be that those muscles, and actually another concept I'll relate to that too, is the pain between the shoulder blades can be honestly because those muscles are also weak. And a lot of times muscles that are weak will also tighten. And so a lot of times that can contribute. But yeah, the neck and the ribs being out of place is kind of a, I won't use that term, but maybe having a little bit of, you know, malalignment maybe can definitely relate a little bit. But I would say it's more kind of more the movement issue maybe of the shoulder blades themselves more than anything. Okay, Sabrina. Why would my shoulder pop every time I move my arm up and down when I go in a circle? So I'll be honest, I have a lot of people come in being like, my shoulders pop. And I'm like, cool, does it pop and does it give you pain? A lot of times if it's popping and not giving you any pain, I'll be honest, I just like, okay, don't worry about it. If it causes pain, that's something different. But when shoulders pop, it's no different than like having your knuckles pop. Sometimes we just get a little bit of nitrogen in there and you just feel a pop, or something's just kind of, you know, readjusting back into place. That's also a dramatic way of saying that. So when your shoulders are popping, when you're going in a circle, basically what that might tell me is you might have a little bit of rotator cuff weakness because it's not keeping that nice and smooth in through there. And so that could be contributing. If you have additional shoulder pain, that could maybe be, you know, why that's happening. If you're not having pain with it and you just kind of feeling some popping, honestly, it just happens sometimes. Our bodies aren't perfect, but at the same time, if you're having issues with it, I would say it's probably due to having some of that weakness in those muscles. I hope that answers your question. Alrighty. Yep, emailing the presentation, that was so calm. So we answered what was the fourth. Okay, so Hylogen injections, I'll be honest, I don't know much about Hylogen injections. Basically, you know, hyaline cartilage does line our joints. And my assumption there was with Hylogen injections is to kind of, you know, keep that deterioration from happening, or if there is some, to help, you know, kind of give it a little bit more of a lining. I'll be honest, I'm not going to sit here and be like, yes, the research says. But basically, I would just say that that is not exactly what I was mentioning with that, but that is something that, you know, there's always, that's okay, I'm good with that. There's always new research out there. There's always new, you know, things coming out, and, you know, we try and stay on top of learning all the new stuff. So, you know what, thank you for bringing that to my attention, because I'll research Hylogen injections a little bit more. I think that's a really cool thing to maybe for me to look into. Okay, so I hope that answered your question about the light dumbbells with the rows instead of the resistance band. You just got to change how the direction you're in order to kind of engage the muscles that you need. Okay, yep, email the handout, certainly. We'll make sure that gets out to you guys. Yeah, Marilyn, Marilyn, I hope that answers your question with, you know, these exercises. Now, if they'll work, it's tough, right? I think they're great places to start. These are all baseline starting exercises. I think they're great for you to try. If it does increase your pain, though, then that's when I would go see a physical therapist. If you do them and you feel great, awesome, fantastic. But no, I think that with orthoscopic surgeries, there really isn't too many like limitations after you have a surgery like that, like any precautions. There's maybe some small precautions to follow, but being 6 months out, you should be just fine to go ahead and give these a try. Okay. Marshall's, yeah, thank you, Margot. So yeah, Marshall's too. I forgot to mention, I've been matching Amazon, but Marshall's does have resistance band too, guys. And Walmart, all of them have really, really good options for you as well. Okay. Oh, thank you, Andrea. I'm glad you found the workshop helpful. The most helpful. Okay, good. All right. I'm just getting a lot of thank yous, and I appreciate you guys. Yeah, you know what I'll do? I'm going to make an additional handout with like the instructions for the exercises too for you guys, because I just showed them and demonstrated them, but I will have specific instructions so you guys can do them correctly. Okay. That is something, and give me maybe a few days to get that created for you, and I'll make sure that Alexa sends that to you guys. Okay. Yeah, so I'm so sorry that you guys didn't get the handouts. That should have been sent to you. So if you didn't get that, you can still, you know what you can do? It can be like a little homework sheet, like go through and answer them. One thing that I, forgot with my very last bonus question is, and this is kind of a big concept for you, for those of you who are still here with me, is how long does it take to see actual strength changes in a muscle? And I'll just go right to the answer there, guys. It's about 4 to 6 weeks. So a lot of times, we want that quick fix. We want that pain gone now. But in reality, to actually make changes in our body, especially in strength, it can take up to 4 to 6 weeks. So when you're going through your therapy, or if you're doing your exercises and you're 3 weeks in and you're just like, dang it, this isn't working, be patient. Do it a little bit longer. This is something that does take commitment and take time to do. And if you're consistent with it, it'll help. It really will. A lot of clicking in posterior deltoid. Okay, Deloy, if you're having a lot of clicking in the back of your shoulder, kind of keep an eye on it. If pain continues, try a lot of these postural exercises and see if it does make a difference, okay? Exercises for recent shoulder replacement. Okay, so Linda, or shoulder replacement. I'll be honest with you. Come see me right now. With shoulder replacement, you're having a lot of precautions right now. Everything I'll say that is probably okay for you to do right now. Now, again, I don't want to give you something that your doctor is going to be really mad at me giving you, right? So I'm going to be, just cautious when I'm saying this. So maybe some just like shoulder blade squeezes, take the rows down a notch into those shoulder blade squeezes, do a lot of neck mobility, stuff that isn't going to actually move your shoulder too much, and make sure that you're following your post-op protocols, okay? But Linda, come in and see us. You want to have therapy after a recent shoulder replacement. That is going to be super, super good for you, okay? Okay, so Margot's saying I've been doing PT for shoulder pain for about 3 weeks now. Oh, if you guys could mute, that would be awesome. We're gonna just mute everyone back again, okay? If you could please mute yourselves, and I apologize for that ask, but this way we can just kind of, keep everyone, from the interference here. Okay, cool. So, all right. So Margot was saying she's been in PT for about 3 weeks now. Exercises are helping. Pain is reduced, Hobble. Add in a few more concepts. Great. So Margot, I'm glad that's all helpful. And guys, I want you to keep in mind that keep up with these. Even the moment your pain stops, don't stop your exercises. That is something that I have a kind of some things my patients will be like, oh, I'm not coming back because my pain's better. And then I see them a month later. And then, because they're having pain. Okay, so keep up with them. One concept I want to say real quick, I had so many things in my brain to share with you guys today, but just because you go to the dentist doesn't mean you stop brushing your teeth, right? So if something's helping, keep doing it, keep with a maintenance program. Hey guys, if you could please mute, that would be awesome. I'm hearing a lot of chit chat. And it's only because, I just want to make sure. I'm going to mute everybody. Okay. Thank you, and I'm really sorry about that. I know you guys want to get going, and I don't want to keep you any longer than I need to, okay? Okay, so let me scoot down on these comments. Yep, I'll email everything to you guys, okay? I promise. I'm so sorry you didn't receive it. Yeah, and you know what? For those of you who are, not coming into the clinic because of COVID, totally okay. Give these a try. If you continue to have issues, check with your insurance too. Sometimes we can still do telemed. They're starting to taper off of that a little bit, but telemed is also a really good answer for some people who are staying at home and trying to improve as well. So don't be afraid to look into that as well, okay? Most insurances are being a little tough with it. We probably shouldn't mention it a whole heck of a lot, but that is something for you guys still staying at home. Maybe just kind of talk to our guys here. We can see what we can do with that. Okay. I've learned more with you than the VA. Oh, yes, the VA, there's all sorts of different things happening there, but I'm really glad that this was, very helpful for you. But yeah, please, you can certainly, anyone who wants to come in and see me specifically, I'm over at our Swan and Camp Lowell location. Be happy to do a consult with you guys and talk about anything more specific. Be like, hey, I saw your module. This is what's going on with me. I can decipher your stuff even a little bit further than, unfortunately going through comments. So if you have anything specific, bring it in. Love to take a look at it with you guys. Thank you guys for the thanks. I get nervous sometimes doing these things. So I appreciate you guys, being, really nice with me here. And, first time we're really doing Zoom. I'm doing Zoom with this, I should say. And yeah. So you guys, please feel free. Oh, I got one more here. Sorry, Eileen. I did not get surgery in PT, rehab my strength, mobility. Great. Oh, you did dislocate your shoulder. So you know what you're talking about having some injuries there. So, Eileen, go ahead and, if you want to go ahead, and I'm glad that you do your PT every week. If you ever have anything more that you need, any more information, it looks like you had quite a number done with that injury there. That's a great example, everyone, of having a really full injury there and having a lot of different things happen. And I'm very grateful that PT has been helping you. But yeah, if you ever need anything more, please let me know. Okay, so this is from, thank you. I feel very tender in the T1 area. Is that shoulder related, upper traps? Okay, yes. So in our T1 area, where our cervical spine ends and our thoracic spine begins is a junction called our CT junction. Again, only so many things I can go through, you guys, in an amount of time here. But that can get so tight on a lot of people with that upper cross syndrome. So a lot of that, thoracic mobility exercises, in addition to your chin tucks and the postural stuff, give that a try. see if that tenderness starts to feel a little bit better. If not, you know, that's something, you know, I'm also a very manual hands-on therapist. Sometimes you just need to get it moving a little bit better. So I'll be happy to look at that for you too sometime if you need it. Yes, I'll email you. KT tape. Oh boy. So here it is, KT tape. So guys, I'll be honest, taping's great. A lot of my clinicians and a lot of my assistants and other therapists do a lot of taping. Postural taping is something that could be used for kind of guidance and where you need to go. With posture, it's something that can be very beneficial. I don't do a lot of it. And that's just something I'm just not as skilled in, I guess you could say. I rely more on muscular activation, but KT taping, if done correctly, can be, you know, a good thing. Maybe we'll talk about doing a taping module in the future for some people who are a little bit more interested in taping. So I thought you were raising your hand there, Paula. She's like, I got a question about taping. That brings me to one other thing about bracing taping, guys, here. I actually had maybe 3 different patients, you know, my own patients this week be like, what if I got a postural brace? You know, you see those on your ads on Facebook that you probably shouldn't click on because now the Russians have your information. But, you know, so if you are using a brace, a back brace, any kind of bracing to help stabilize yourself, it is, you know, I'll say it is a cool thing to wear at first, maybe for like 30 seconds to be like, oh yeah, my posture's terrible. This is where it needs to be. Take it right off, all the way off, throw it in the trash. Because if you're wearing a brace and to help keep you in a position, your muscles will be like, oh, something else is doing work. I don't need to. So then as soon as you take off that brace, you're going to feel like a big thing of jello because your muscles are no longer stabilizing you. If they weren't stabilizing you before, they're definitely not stabilizing you now. So bracing, you know, if you guys ever have any questions on that, you know, I think it's cool to have maybe something to remind you to sit up tall, maybe even set an alarm, you know, something along the lines as like a cue, like a cueing type thing. But anything more for a brace that's more than cueing should not be used. And I will, you know, till the day I die, I'll say that. Okay, so the exercise for no monies, Marlene, is for your rotator cuff. You know, all the 3 muscles that are in the back here are rotator cuff muscles. That's for strengthening those guys. That's for activating those. And those are super, super important. Sometimes you get an ice feeling on the top of your shoulder running down your arm. Is that shoulder or neck? Can I do something for this? Okay, so that is something that gets a little bit more challenging because now we're involving nerves. So yeah, and sorry you don't have your name here. It just says thank you. But basically, if you're having numbness, tingling, sensation changes coming down your arm, that is potentially coming from the neck or a pinched nerve coming down the shoulder. So that's a whole nother game. I'd need 5 more hours with you guys talking about nerve impingements and nerve injuries and things that are happening in the neck. But yeah, I mean, something can be done for that. It would just, I'll be honest with you, I would have to feel it. I would have to take a look and actually get a little bit more information. Unfortunately, I wouldn't be able to answer the question just kind of looking at the description, but I think it'd be great if you were to come in and have someone take a look at it. I think that would be very beneficial because that could give you a little bit more information as to why that's occurring. All right, thank you guys for, I know some of you, you know, are leaving. Thank you for hanging out. And yeah, I'm really glad you guys found this helpful. That was my big goal. It's just to get you guys, you know, a little bit more information. And I think, oh no, we have some more. I'm sorry. I'm just scrolling down here. Yeah, if you feel that you're, I'm reading a comment here from Pat saying, when I have shoulder pain, it often feels like my neck needs to be adjusted. I want to stretch all the time. So yeah, you guys feel like you just want to crack your neck? Or, you know, you've been to the chiropractor and you feel like, yeah, I just need to like stretch this out. A lot of times when we're weak, we tend to also feel tight. You get that, right? With the upper cross syndrome, with having weak and tightness both be an issue. When a lot of times if we have pain, a lot of our muscles around that area will also just tighten up. So it's like, God, I need to just like crack my neck. A lot of times it's more that we need to stabilize the neck. Example, I had a patient with chronic back pain, for example. I loosened up all the muscles, you know, a lot of different releases. And then as soon as she got off of the table, she wanted to adjust her back. But it was because her spine finally was like, oh my goodness, I have no stability. and I have to try and adjust myself. And that's sometimes what the neck does. If you have, you know, your upper traps and you're kind of stuck like this, the neck is just kind of like, oh my gosh, I need to move, I need to adjust. And so honestly, start with your mobility exercises, your stretching exercises, and then your strengthening exercises. Let's see if your neck does feel better. If not, come and see me, because necks are like, shoulders are my jam, but necks are the cervical spine is my second jam, my butter, if you will. So some people answering some more questions about, you know, my bonus questions. I think that, and so, you know what, my chat started over from the top. I'm like reading these questions again. I'm like, I think I saw these already. You know what? I think that's it. Does anyone have any more questions? Again, sorry that, you know, the handout was meant to have you guys to follow along with. I hope that you still were able to follow along okay, but maybe instead of using it as a handout, we'll use it as like a little homework assignment for you guys to fill in. When you get the PowerPoint, you can certainly use that with the handout to really kind of get a good idea. Does everyone see my information? Alexa, do you see my information now in that chat box for everyone to have?
No, I did not see your information. So if you could just send it one more time, that'd be great.
Yeah, absolutely.
And then just so everybody knows, we're going to be sending out the presentation as well as the 10 burning questions, which are 10 of the most frequently asked questions about shoulder pain. And we did record this workshop, so we'll be uploading it to our YouTube next week. You'll get this email on Monday. And just so you know, the platform that we use to send out the emails, we unfortunately don't get your responses if you're replying to them. So if you have any further questions or anything, go ahead and email Bridgette or myself. I'll put my email in here as well. And just again, for the free consults, I'll put the link one more time. I've been putting it consistently throughout. So you can just sign up through there. And
Alexa, can we add Bridgette's information to that email as well?
Sure. Yeah, I'll let them know to do that.
And one last thing, guys, too, I know this was a workshop on the shoulder, but you know, you can, if you're having other issues, you know, please feel free to, you know, stop on in and do a free consult about something else. You know, not to steer too, you know, going into a rabbit hole here, but we also have really, really good pelvic floor physical therapists throughout our company. So if you are experiencing any pelvic floor issues too, you are more than welcome to do a free consult for anything along those lines too. But then in addition, anything else, us orthopedic physical therapists, basically everything head to toe. So shoulders, my favorite thing, but we are all specialized in every part of the body. So please feel free, if you have, you know, anything for other areas that you're experiencing, schedule that free consult too. When you click on the link, it doesn't just have to be shoulder pain. You know, feel free to, you know, kind of address other things that are giving you an issue too, to talk to a physical therapist, because that's going to be super helpful when you can talk to a movement specialist about these sort of things. Okay. Daryl, I just saw your question here very lastly. Can you do PT over Zoom? So that is, you know, something that a lot of companies and a lot of insurance companies have been allowing during the pandemic is telehealth visits. It's a tough question to answer because it does depend on your insurance. Most of the insurance plans are not approving telehealth physical therapy visits anymore, but some still are. I still have a few patients I'm seeing via telehealth, and one thing that you know someone could do is, if you do, this is something if you were to pay out of pocket, you could do something for. But most insurances right now are starting to wean off of the telehealth. So to answer your question, Daryl, maybe you would just A, have to call one of our clinics, B, talk to your insurance, and that will get you a little better answer than unfortunately me right now. So I hope that, you know, directs you appropriately. All right. Does anyone else have any other questions for me?
If you don't, you can go ahead and leave the Zoom and look out for that email on Monday.
All right. Thank you, guys. Thanks for everyone who's still hanging out with me. Hope you guys have a great Saturday and still be safe out there. We'll see you soon. room.